There are a number of different movements possible at a joint. These movements are caused by our muscles and they are known as joint actions. Hopefully we remember that the hinge joints in our bodies include the elbow joint and knee joint. Hinge joints allow for two types of movement only, flexion and extension. Flexion is the narrowing of the angle at a joint, whereas extension is the widening of the angle at a joint. We can use a bicep curl as an example. As a bicep curl is performed, the angle at the elbow joint gets smaller. This means that flexion has occurred. We also must be aware of the muscles contracting and relaxing to cause this action of flexion. As you can probably guess, the bicep muscle is the agonist, which means it contracts, whereas the tricep is the antagonist, which means it is relaxing during this movement. If we look at the exercise of a tricep extension, the roles are simply reversed. The tricep becomes the agonist, whereas the bicep is the antagonist. This causes the action of extension as the angle at the elbow joint is widening during this movement. Flexion and extension also take place at the knee joint. We can use the example of a squat. As the weightlifter squats down, the angle at the knee joint gets smaller, so this is the action of flexion. During this action, the hamstring contracts and the quadriceps relax. On the way back up, the action is extension as the angle at the knee joint gets bigger. During this movement, the quadriceps become the agonist and the hamstrings are the antagonist muscle. At a ball and socket joint, there are a number of joint actions available. These actions include flexion, extension, abduction, adduction, rotation, and circumduction. At the shoulder joint, extension occurs when we raise our arm forwards and into the air. The deltoid contracts and the pectorals relax to cause this action. Flexion occurs as our arm is lowered, with the pectorals now the agonist and the deltoid the antagonist. Abduction is an action which occurs when we take our arm away from the midline of the body. When the arm returns to the midline, this action is called adduction. A tennis player uses abduction at the shoulder joint to prepare a forehand shot before using adduction to hit the ball and follow through. Abduction at the shoulder is caused by the deltoid contracting and the pectorals relaxing. For adduction, the opposite occurs, with the pectorals contracting and the deltoid relaxing. Two other actions are also available at the shoulder joint. Rotation occurs when there is movement in a circular motion, but not 360 degrees of movement. Circumduction at the shoulder is when your arm rotates 360 degrees, such as when a cricketer bowls a ball. A number of different muscles are involved in this action. All of the joint actions that are possible at the shoulder are also possible at the hip. Flexion at the hip joint occurs when we bring our knee towards our chest, as the angle at the hip is narrowing. This is caused by the contraction of a muscle called the hip flexors. As the hip flexors contract, the gluteals relax. Extension at the hip occurs when our leg is extended behind our body, for example, when a footballer prepares to take a shot. The gluteals become the agonist when extension at the hip takes place, with the hip flexors the antagonist. Moving our leg away from the midline of our body results in abduction at the hip joint. As our leg returns to the midline, adduction occurs. The gluteals contract to cause abduction, whereas the hip flexors contract during adduction. Rotation and circumduction can also take place at the hip. An example of circumduction is when somebody is hula hooping. Again, a number of muscles are responsible for the actions of rotation and circumduction. This topic takes a bit of revising and revisiting to master. It may be useful to perform the actions yourself as practice, and this table will also be useful in helping you to learn about each joint action and which muscles are involved.